Hey y'all, Azim here. We're going to talk about the different parts of vertebrae. We'll talk about vertebrae in general, and then we'll point out the differences between cervical, thoracic, and lumbar. So, we're looking at a superior view of a vertebra. This large, round part, this is the body, the vertebral body. And this is what's supporting most of the weight. If we look at another example, like this one here, we can see that this is a lateral view, the vertebral bodies are supporting the weight, and in between each vertebral body you've got intervertebral discs. These discs are made up of fibrocartilage, that very, very tough cartilage that appears like all the collagen fibers are in the same wavy direction. So that's the body. This whole part here is known as the vertebral arch, but we can be more specific than that. Let's first point out these pointy parts. This pointy part here is the spinous process. It's an attachment point for ligaments and tendons, so for muscles. The spinous process points posteriorly. So if we look at a spine, we see that the spinous processes point posteriorly, while the bodies are anterior. These are the transverse processes. There are also attachment points for ligaments and for tendons. We'll talk about muscles that help stabilize the spine later. If we're talking about thoracic vertebrae, they also help with articulation of the rib. So you can see the transverse process articulating with a rib bone here. So all ribs articulate with thoracic vertebrae posteriorly. So we have our transverse processes, we've got our spinous process. The whole thing is the arch, but you'll notice that we can also point out different parts of the arch. Suppose the arch is better seen like this. So here's the arch. Here's the transverse process, here's the body. This little segment between the body and the transverse process, this is the pedicle. Think of this as like a mountain, and when you have mountains, you also have the foot of the mountain. This is the foot of the mountain. Ped means foot. So here's the pedicle in between the transverse foramen and the body. Between the transverse transverse process. Between the transverse process and the spinous process, you have the lamina. So the slope up to the tip of the mountain, that's the lamina. Lamina means layer. So vertebral arch is pedicle, transverse process, lamina, spinous process, and repeating that on the other side. Lamina, transverse process, pedicle, body. All together, the vertebral arch and the body form a whole. This is the vertebral canal, or the vertebral foramen. This is so the spinal cord can pass through. Spinal cord can pass through that vertebral canal, as well as spinal nerves if we're in the lower part of the more caudal part of the spine. Other important features can be seen in different angles. For example, if we have two vertebrae stacked on one another, we can see that when they stack, not only are they articulating here between the bodies, with these intervertebral discs, intervertebral discs, these fibrocartilage pads, but we also have these flat articulation points. There's this one here on the underside of this vertebra, and this one here on the superior portion of this vertebra. So on this one, this lower one, this would be the superior articular facet, while this one on this vertebra is the inferior articular facet. Looking at that on a single bone, superior articular facet, inferior articular facet. So these vertebrae have these articular facets, superior and inferior, so that they can articulate with other vertebrae. When we can, of course, move our spine around, and it's not because of this. These intervertebral discs don't move very much. They're amphiarthrotic joints. These joints between the inferior and superior articular facets, those are synovial joints. They're highly movable. The special word for them is zygapophyseal joints. Zygapophyseal. Zygapophyseal joints, or you can just call them Z joints. These are the highly movable joints that let you bend and flex your spine. So you can see that they're all together here. Inferior, superior, inferior, superior. It's going all the way across. When we form this joint, one more thing you can see is that we have a hole here that's formed when you have two vertebrae together. This is the intervertebral foramen, and the intervertebral foramen is to allow nerves to pass through. The intervertebral foramina are for nerves to pass through. If we damage an intervertebral disc, a problem that can happen is that the disc can break open. This is representing a broken, ruptured disc. And now the ruptured disc is pushing into that space where the intervertebral foramen is, which is where the nerve is. And that's how you get a pinched nerve and can experience conditions like sciatica. Just a different view. Here you can see all the intervertebral foramina with nerves passing through them, spinal nerves going through. Lastly, how do we tell the difference between, one more thing about facets. You've got your superior articular facet, inferior articular facet, and those are for articulating with vertebrae, forming those Z joints. If we're in the thoracic vertebrae, one more thing you can see here along the body are these half facets or demifacets. They're called costal facets because remember, for the thoracic vertebrae, you have the rib, here's the posterior part of the rib, articulating with the transverse processes and with that portion of the body, the costal facets. Let me show you an example on the skeleton. You can see here's the transverse process, and then tucked away, the rib is articulating here in those costal facets on the thoracic vertebrae on the body. All right, what I meant to say was how do we figure out what is a thoracic vertebra, what is a cervical vertebra, and what is a lumbar vertebra? In general, lumbar is the biggest, which makes sense because it's supporting the most weight. The 5 lumbar vertebrae, 1, 2, 3, 4, 5, or I should say 1, 2, 3, 4, 5, they're supporting the most weight. They need to have the largest bodies. You'll notice that the spinous process looks pretty, it's sharp, but it's flat, like a flathead screwdriver. And when you look at it, kind of looks like a moose. There's the antlers. Here's the nose of our moose. Lumbar vertebra, big and chunky, has to support the most weight. Looks like a moose. Thoracic vertebra, decent sized body, but not as big. The superior articular facet form these tinier horns. The inferior articular the inferior articular facets form these cheeks of our giraffe. The thoracic vertebra looks like a giraffe. Again, they also have the costal facets that the others don't. Very different is the cervical vertebra. You can see how the size difference. Lumbar, thoracic, cervical. Look at the spinous processes of each. Very wide for the lumbar vertebra, big round moose nose. The giraffe nose is much pointier, much sharper. Let me give you a better example. Here's one that's higher up, more superior. Very sharp, and it generally points down. the spinous process of the thoracic vertebra generally points down. When we get to cervical vertebrae, it's pointing fairly horizontally, not perfectly, but more horizontally than inferiorly. It looks a little like an elephant. Here are the elephant ears. This is the trunk. It's making that noise it does when it lifts its trunk. The articular facets are facing up. They're more superior for the superior side and more inferior for the inferior side. Again, compare that with the thoracic vertebrae. They're kind of facing posterior and anterior. So the articular facets are facing a bit differently. One more key feature of the cervical vertebrae, you'll notice these holes. Well, much smaller body, and you'll notice these holes here. If this is the vertebral foramen, vertebral canal, these are the transverse foramina. And the transverse foramina are to allow nerves and blood vessels to pass up into the brain. It's one way to deliver blood into the brain. And those are only found for the cervical vertebrae.